India de amikhan laga state Nagaland to HIV/AIDS laga status pitor de rank second day with 1.61%. Enaka humoi de Nagaland State AIDS Control Society and Sex Contra ekta initiative ligena ekta surgical strike HIV/AIDS opor de screening hubi nolibi individuals kan takan laga status janibole itu ekta campaign launch kurise. Aru itu campaign laga naam tu integrated health campaign ase. Itu laga campaign tu khali Dimapur district ekla nohegina alak district such as Newland aru Chumukitima debi itu campaign tu launch kuribole ase kona itu bi janai dia ase. Itu laga campaign opor luigina and sex officials kan tai khan hotspot khan de jaigina itu public khan ge takan laga status khan itu screen kuribole laga ekta ase. Aru itu screening campaign de khali HIV/AIDS ekla nohegina malaria hubi nolibi tuberculosis TB khan hubi itu ala opor de screening ta thakibole ase kona itu janai dishi. Aibi aji laga program opor de nolibi itu laga campaign opor de ami khan epar sailo.
Very good morning to all of you. I on behalf of the department would like to welcome all of you to the launching program of the integrated health campaign to be held here at Dimapur district. Especially I would also like to welcome Imli Jabba EAC, who is representing the Deputy Commissioner, Dr. Dimapur Shintram. Both the administration has been very cooperative and very supportive to all our health programs. And so I would like to take the opportunity to once again thank them for the support that they have given to all our health programs, irrespective of the time constraints that they have, but they have always been there supporting us in all our programs. So thank you and welcome especially to the administration as well. I would also like to welcome Dr. Agul Singh, who is the Project Director of NSEX, who will be presenting the keynote address. To all the TI NGOs, to all my colleagues who are here, to all the program officers of the various programs that are involved in this integrated health campaign, for my colleagues from the state, Dr. Assam, Dr. Zayawang, also to the media wing, and then to the and also I would like to thank welcome the development partners who are here helping in the program related to NSEX, the TI NGOs, and the Gambra Union who are here. They will be very important, especially as we go about with the campaign. Their help and then their cooperation will be very much required for the success of this campaign. So I'd like to further welcome you all to this very important program where we will be reaching out to the public, to the population who are not able to come to our health facilities. And so this will be something like a doorstep program that we're taking to the community so that they may avail the testing facilities that we have so that we can help them screen themselves so that they know their status. Likewise, screen out for all the other the integrated programs that will be that is part of this this health campaign. We will be having so in a nutshell the NCD program, that's non-communicable diseases, the TB program, the vector-borne program, malaria, dengue. I think we all have been well experienced last year. And so with the weather playing sport, we've got the temperature changes coming up, we've got the sudden rains coming in, and the hot sun. And so here we also expect cases to be coming up. And so this is an integrated campaign where everyone's involvement is very important. And so no one is less important than anyone in this campaign that we are launching. So this is just, so I would welcome everyone who is here, who will be helping us and who will also be aiding us and whose cooperation is very much required so as to mobilize all those who are not able to come to the health units. And so, just with just few words, I'd like to welcome each and every one of you who are here, especially the media persons for the coverage that you are providing. Thank you. And also from our department, we would also like to request that each and every one of us take active participation during this campaign so that it will be a grand success. Thank you.
Good morning, ladies and gentlemen. all, I would like to acknowledge the CC's office by Dimapur and for facilitating our launching program this morning. And yes, there are a lot of dignitaries present, and I acknowledge your presence and thank you all. At the outset, I saw conjugate to Atila program to key laga launching Korea say from Budaya Development. Nagaland Age Control Society NSEX itu Delhi under Health and Family Welfare NECO National Age Control Organization ichide kaam kore. Itu regular monitoring kore aro itu NECO to certain timeline target fix korigine itu target kanke achieve koribole mohan activities controlling thake. So India ACP 5 korigine India latest ekta program kara itu program to the year 25-26 there AIDS HIV AIDS related manu itu करने बीमार हुआ itu करने मरी जा itu 80% को itu reduce करे बोले target sorry किने मोहन चुकी आती है. So based on that, in the same line, एकता 95 कोई किने एकता target उलाई दी है. itu सब state India the सब state itu achieve करे बोले मोहन क्या itu करने काम करे आते हैं. और 95-96 to Asia punja ase, so itu loha itu time na punja ke itu target achieve koribole. So aji program bhi itu laga time hai Korea ase. 95 to matlab ki time laga meaning ki ase bole Mohan state all over India aru Nagaland in particular there jiman manu itu HIV AIDS बीमार itu HIV AIDS virus to taikan ke affect korigine ase taikan ke janai bole taikan laga status taikan bole taikan HIV AIDS virus taikan bole ase to taikan status to taikan ke janai bole itu number one target to ase. So number second 95 and third 95 to directly hit to first 95 के main तादे बड़ा शुरू करी गए ताइकान status जना पासवर्ड ताइकान के आजी गाली तो AIDS बीमार तो दवाई खाई जैसे मोहन लोगों ने भी so itu दवाई खाई ले normal life लीड करो पड़े so itu treatment या हदी बोले itu target second target to 95%. Third 95 to जिमान मनु population है जिमान मनु की जाएगी AIDS positive आसे इतु दवाई खास शुरू कर दिवो इतु दवाई खास शुरू कर दिले ताकन लगा खाओ ते HIV virus to पहला नंबर viral load right ताकन लगा इतु suppress ते control ते रख दिवो इतु third target ते so मोहन Nagaland ते Dimapur district especially that patient load बेसी आसे पूरा नागालैंड है highest patient load को मोहन Dimapur district है itu करने मोहन इंडिया Dimapur office में है. So itu program lines in line with this program this IHC integrated health campaign to northeast first to Arunachal Pradesh में conduct और अरुणाचल ते Arunachal भी unfortunately ताई लगा increasing trend आसे ताते Arunachal state ते HIV prevalence to increase हुआ आसे so ताते क्या main focus national focus to ताते आसे एक ताते इतु program IC बंदा कोई one success होइछे और positive case hidden case कोई ला लगा case detect करो so इना बोलते Nagaland में भी conduct करिए इधर latest आसाम से conduct करिए आसाम में भी 300 hidden cases पाइए to campaign करा हुआ है so similarly मोहन Nagaland से मोहन first parental conduct करिए और उस लोगों को conduct So India mohan parent conduct kora to experience bisi paise. Kiniga kurile case to generate kulo India ka. So India ka to India zona kulo experience kam loi kene mohan Dimapur le box kure ase. So we are hoping and we are very hopeful that we will achieve a very meaningful outcome through this exercise, especially by the in collaboration with the district administration and all other related components and departments that we have available in the district. So, Kobo kole itu HIV next speakers can be going to go itu Mukhan, as much as we into HIV bimar lokote stigma associate na awareness program to for several years now Mukhan exercise alag mange awareness ani ki bole itu bimar to stigma associate na kori bole itu bimar to at a point of time till the early 80s itu bimar to power. You get infected with the disease and you die of the disease in your life. Only now, fortunately, with the breakthrough of all these scientific developments, we now have we are armed at least. Bukan lokote itu tawaya set. So itu bar bi bukan INC conduct kore jatuh itu awareness mainly itu awareness create korbo. Aru bukan bunyi target surgical strike kore kita bunyi target. Itu bi ICD surgical strike is naik ta set. Main focus to bukan HIV the focus korbo la set. But along with that, alag bimar kan, especially hepatitis bimar, TB bimar, alag bimar kan bisa. Tadi itu adalah the cover that to try to solve. So once again, I wish the program all success, and with this I conclude. Thank you very much.
NGOs, media persons, GP unions, once again, welcome to the Integrated Health Campaign for Dimapur District. First of all, I'd like to convey apologies from our Deputy Commissioner. He and also my other senior colleagues are in a training program related to the ULP elections with the SEC. We know that with medical advancement, early detection in pregnant women can prevent the baby from having born with that disease. So that's very important. It goes a long way in preventing at least one extra, in addition to that. And then early treatment, we know that nowadays, even the people are able to live to a certain extent a very good and well-rounded life with treatments. So that that intervention is only possible when they are detected early, and then it can help in prevention. So these kind of camps will go a long way, and it's sort of like a last mile connectivity in providing services. When we talk about providing services today, so this kind of health camps, integrated health camps, is our way of last mile connectivity through that we are going out and reaching out and then screening especially the high risk groups. We have already emphasized a lot, sir, I have already emphasized and everyone has emphasized a lot on the stigma associated with especially HIV, and that can't be emphasized more. It has to be emphasized more because that is one of the big reasons why some people will tend to hide because of the stigma, and that again might lead to even more people not coming forward for screening also. And then so in that case, our society also needs to, our media and also our society needs to play a big role in trying to reduce the stigma associated with the HIV positive cases, and also and also to highlight how people can live normal lives, and it is just like any other disease that we have nowadays, and people can live normal lives. We see, I'm sure everyone of us knows at least a couple of people who are leading perfectly good lives even after being diagnosed with this disease. So that is our role as a government and also as a society to try and reduce the stigma associated point out like one of the thing with the integrated health program is the comprehensive package that is being provided. Not only will it go a long way in anonymity, but also in terms of, we know the non-communicable disease is one of the biggest killers when it comes to death rates, when we talk about diabetes, these are the silent killers of our society. So it's a very good step in achieving our SDG goals also of good health and well-being, because many of us, because all these are dependent on early detection and screening, and our lifestyle changes. So this is not just, the program is not only going to be beneficial in the HIV/AIDS prevention and reduction program itself, but also in trying to reduce the incidence of the non-communicable diseases and its screening, and how to change our lifestyle in order to prevent such things. So, like I've already emphasized before, I think this is a group effort. It's a convergent program. We have a lot of key players, and especially the NGOs who on the field are going to do the main job, but we need the help of the public and especially our civil societies, for people also to come forward, and also to so this program is not going to be successful if all those we don't come together. So that is again, lastly, I'm just reiterating that from on behalf, and we know that with the health department we always work in cooperation. It's one of the most active departments, and we really appreciate the medical department and the different various programs under it. They are always quite active, and we appreciate. And despite our very limited sometimes resources and infrastructures, they are trying their best to reach out with their services, and so we will together go hand in hand in trying to, move towards healthier society, and also healthy body, spirit, and mind. And so with that, I would like to once again, thank you all for coming as well. And also apologies for the delay again. So thank you so much.
Hoi moana itu in comprehensive service package ko bode. To kali HIV laga camp health camp ase ko lekun bi nahi bo to. Itu pra mon services to alak offer kore ase. HIV testing ekla na hoi gene syphilis, TB, malaria ini ana alak testing kuribo mon. To itu opor TB khali malaria, TB, syphilis ekla na hoi gene hepatitis bi thakibo de. Hepatitis testing B and CB bisi high ase mon last state itu bi thakibo. Aro non communicable disease kwatu diabetes, hypertension kwatu itu BP na. BP high BP laga, aro anemia to ile khun kumti hoi jai na, itu laga, aro dosra local needs hisab te services to offer koro bola ase.
So ma'am, apni PowerPoint ya damde Nagaland to India de second leading ase kuche HIV, aro first to Mizoram ase kuche. So apni kan idu prevent kurbo ane ki steps lo ase ma'am.
So prevent kuro kanwe mon ekla department bi napara hoi jai na. Itu pra mon to services to hospital khante dia ase to. Holibi PHC, CHC niga khante bi sob center ase. Holibi itu ekla pra bi napare, itu pra NGOs kan la help loi. Mon laga NSEX kwala niche te NGOs bishi ase. Itu khambra kun drugs inject kura khan noilibi female sex workers na. Inika kura khan high risk population khan lote reach out kurule mon NGOs kan ke bi engage kore.
So ma'am, ikadakte HIV infected manu khan do bishibak positively apni kan log reach out pi nokore kuche. So itu laga opor de apni kan bi takan ke ki appeal kore ma'am.
Itu bra mon paratak to language alak tibi common means local dialect tibi translate kurine hospital khan noilibi busti han de moambi to distribute kurese aru hospital han tibi ki service tibo ki hoile test kurbo nije ke jani bole na inia translation bi ase aru mon outreach activity koide itu link workers kan iniga alak pra busti de tahan kiba program khan thakili bi na hornbill ti holibi mon lastol hodai thake aro any other public activity thakile mon tate mon advertise kore test kuri nijula status janibi ni ana itu one IEC koi to ke information education communication, that is a very important win of our department.
So ma'am, lastly, ekta question do apuni kan inika integrated health campaign kan to thaki ase. Boli bi pusti interior de house to house jabuli la campaign kan bi kurina no kuri ma'am.
Itu kuasa outreach workers, link workers scheme koine thake de. Itu handu ele moi supposing tai adona to drugs inject kore na to tai sati thakibo to tai la group thakibo to na itu behavior hisabte moi tai la busti te ekje manu ke choose korbo NGO pra na to tai ke tahan lote jaine convince korla aine testing koribi aro drugs inject korili bi needle iki na cholaibi inigana like those kind of things are going on holistic ma to itia bi bichi high ase and we have a lot of work to do and we hope that everybody will cooperate with us the media especially.
Itu campaign to doorstep campaign hole asna kinga.
Doorstep no hoy itu to ele kwan is na mon la project director pra kwan na surgical strike kwa tu ini for example railway gate ko bi kumba jaga NGOs khan to kam kore jane kun jaga te ki manu khan jama hoy na female sex workers holi bi thake noile bi drugs khan kora khan bi thake ni alak aro highway khan de truckers khan thake to truckers khan bi ta ami bishi high risk lifestyle ase de because gor pra moina bhar thaki jai to itu hala hot spot koi tan rukha laga jaga thake to itu hot spot khande jabole ase not doorstep to doorstep but there are some hot spots selected site which we have already selected and it is going to be like a surgical strike I said.